Hello, my name is Jennifer Matos. Today I'll be speaking to you about congenital heart defects, something I know firsthand about. In February, my youngest son was born with a very rare heart defect. Every year, 1 in 100 babies born are born with a heart defect. Sometimes it's detected in an ultrasound and sometimes not. Unfortunately for us, it wasn't detected. So come hear our story of our journey. When Gabriel was born breathing very rapidly and turning a little blue. We drew our concerns to the doctors and nurses, but they assured us it was perfectly fine and it would go away. We were sent home. When Gabriel was 7 days old, it still hadn't gone away. I grew more concerned. We took him to our local ER. This is where Gabriel was diagnosed with hyperplastic right heart syndrome, also known as tricuspid artesia. This only occurs in 2 out of every 10,000 births. He also has cortation of the aorta and transposition of the great arteries. Here is a picture of Gabriel's heart. This black space right here is the whole right ventricle that didn't form. This is a transposition of the arteries, and as you see, he has no aortic arch. There are many kinds of heart defects that include hyperplastic left heart syndrome, double aortic arch, Williams syndrome, long OT syndrome, and there's many more. Sometimes the mother's habits have nothing to do with the heart defect. Like me, I always did what I was supposed to. I ate right, went to my appointments, took my vitamins, and still I had a baby born with a heart defect. You're probably wondering, how can you tell if your baby has a heart defect? Well, first of all, as a mother, trust your heart. Always know that a mother's instinct is what's right. If you feel something's wrong, it probably is. Second of all, if the baby's breathing heavy, there's a draw for concern. And number 3, obviously if the baby's turning blue, there's something wrong and something needs to be checked out. Have your doctor do an O2 stat test. Never take no for an answer. You as a mother have the right to know if your baby has a heart defect or not before you leave the hospital. Always know. And if you have a baby that has a heart defect, know that you are not alone. Right here in Florida, there are many babies with heart defects. You never know how many babies are born until you visit a pediatric cardiac ICU. I know I sure didn't. Until I had Gabriel, I knew that the disease existed, but I had no idea how many babies actually are born with it. And you're probably wondering, what happens to these babies born with a heart defect? Well, many babies have 3 surgeries, including my son. My son has had 2 already. We're awaiting our 3rd. The first one is called the Norwood procedure. This is Gabriel post-Norwood. This is where a shunt is put in place to have the blood flow to the pulmonary arteries, and the aortic arch is reformed and it's worked on, and there's a whole aortic arch put in. Second, this is usually done within a few days of life. Gabriel was 9 days old when his surgery was done, and it's the most critical. Our surgery lasted about 17 hours. The second surgery is called the Glenn procedure, which is done usually between 5 to 6 months of age. Gabriel was 5 months old. This is called the Glenn procedure, which is less critical. This is where the shunt's removed and some of the pulmonary arteries are placed together. And it's getting the heart ready for the 3rd surgery, which is the Fontan. The Fontan is usually typically done between ages 3 to 5, and this is where all the actual arteries are connected. This is the less critical surgery. There's a high survival rate for children. The oldest child that had these 3 surgeries is only 28 years old. So I have faith that my son will grow up to be an amazing man as well. With any surgery, there's risk of complications. We've had our fair share of many. We've had aneurysm in the leg, we've had blood clotting in the lung, we've had blood clots in the pulmonary arteries, we've had decreased oxygen stats. Everyone, he fought harder and harder, and today, well, we're a typical 9-month-old baby, happy as ever, and we're waiting for our 3rd surgery. We eat mostly from a feeding tube. But you know, we're 16 pounds, but hey, he's a happy, healthy baby. This is Gabriel today. A perfectly healthy baby. Are you CHD aware? I was told by a mother in the hospital, Whenever you go in for an ultrasound and you're asking for a boy or a girl, ask for a healthy heart. Make sure that heart is fully developed and it's good to go. And always remember, every time your heart beats, think of a child with a heart defect. Thank you and have a great day.